Today we're going to be talking about metabolic syndrome. What is it and why we must learn to control? We're going to be talking about how metabolic syndrome affects the rest of your body, what are the symptoms, and we're even going to share a tip. If you have been struggling to lose weight, what is one thing that you may be missing? Then make sure that you watch all the episode, get your pen and paper, I got my pen here, and let's make sure that you take all the notes and can get all the tips we're going to share about this problem. Welcome to Be Healthy Podcast, the best way to discover practical tips and holistic health information from amazing wellness experts and even real people with incredible health journey stories to inspire you to become the best version of yourself. I'm Anna Marinho, a self-healing specialist, best-selling author, and public speaker, and I heal myself before, and I know you have the power to heal yourself too. And today, we will talk with Dr. Kellyanne Tomko. She's a licensed naturopath doctor and the owner of Rock and Steam Holistics in Chapel Hills, North Carolina. She specializes in metabolic health, gastrointestinal health, and cognitive health. Her goal is to empower her patients to take their life back from chronic disease in order to live a life full of abundance and purpose. Dr. Kellyanne, thank you so much for joining us today.
Thank you for having me, Anna.
Yes. Okay, then let's dive right in. Tell us a little bit more about what is metabolic syndrome.
So, metabolic syndrome is considered a cluster of symptoms, and this cluster of symptoms together makes up what they call the metabolic syndrome. A lot of times when we think of metabolic syndrome, the big symptoms that we think of are insulin resistance, or is making insulin, but for whatever reason, your body can't sense insulin and doesn't use it properly. Another one is high cholesterol, getting into potential cardiovascular complications. And what I see a lot is people that come in, especially women that can't lose weight. And that's another symptom of the metabolic syndrome is difficulty losing weight or even potential obesity.
Can you tell to our listeners, what are the things they can watch for? They can start to bringing some of the information to someone like you or to their doctor. Should be like, I'm starting to having those symptoms. I'm a bit concerned. Could that be a metabolic syndrome? What are the things they could watch for? Definitely the obesity, the difficulty of losing weight. I think that's a very common problem that people definitely should be aware of. What are other things that they could keep an eye on it?
So I encourage every one of my patients, if they haven't done a full wellness panel, this is a blood panel, I encourage everyone to do that at least once a year. And the power of just using basic blood labs is going to tell you a lot, especially what your blood sugar is doing, what your cholesterol, your triglycerides are doing. And one marker that I also want to discuss is the importance of also looking at fasting insulin. And it's possible to test for that also with a blood lab.
Absolutely. And then that's so important. I think especially the male population, they try to run from doctors, and every person needs to have a checkup once a year. And especially after you get to 35, 40 years old, that's like no negotiable anymore. And if you haven't got your checkup recently, please get all your lab work. Then make sure that you are covered and you can find those things earlier, because I think that's another piece there with the prevention is like the earlier you can get some of those diagnoses or get some of those levels a little bit off, the easier and the faster you can reverse versus waiting until all the lab values are abnormal, and that's a lot harder to reverse and help.
Yes. I also want to note, and I see a lot of women that are perimenopausal or going through menopause. And I always like to, again, encourage that full lab panel. A lot of women, when they hit menopause, they start getting some really weird and wonky symptoms that they're not used to. And menopause is a natural process, but it's also a very inflammatory process to the body. And it's not that you're going through menopause, you're automatically going to develop insulin resistance or cardiovascular disease, but the risk with going through menopause becomes higher, and even with metabolic syndrome. So it's really important to stay on top of that and take a preventative approach.
Absolutely, totally agree. I even tell some of my patients when they're starting to think about menopause, even before the premenopause, like go get your check, know what your normal hormones are. Then when you check
Yes.
when you are in premenopause or menopause, you actually have a baseline to compare to as well. Then you know, okay, this is low for me, or no, this is higher for me, and getting the baseline check. I think that's a really important. And that kind of goes back to the idea of the yearly checkup, because then we know your values. It's easier for you to know what's happening, what's normal for you, or the work that you're doing making a difference, and knowing what direction you go with that. And if someone is having metabolic syndrome, if they're having all of that cluster of problems that you're referring to, what are the things they're experiencing? Like, what are they see on their daily life? They could be feeling as far as the lab is important, but what would be the symptoms itself?
Well, I will say with regards to the metabolic syndrome, the typical first sign that people have and what they're coming to me talking about is, hey, I just gained a bunch of weight and I'm not really sure why. And fatigue. It seems to be weight gain and fatigue seem to be the biggest things that I see. Also, people that just can't sleep at night. They feel like they have a relatively good bedtime, but they wake up a lot in the middle of the night. It affects their sleep quality, and those seem to be the three biggest things that I see. But in terms of cardiovascular health, there's really no symptoms unless someone brings in lab work, like previous lab work. Same with blood sugar. There's usually no, but sometimes I'll see people and they'll be like, I get really hungry, or don't really have much of an appetite. So there is a possibility of those symptoms.
Can you repeat that? Because your camera froze a little bit. You say there is not a lot of symptoms, and then you kind of froze there for a second. Then can you repeat that, please?
Yeah, so there's typically not a lot of symptoms associated with high lipids, high cholesterol, especially in the early phases of that. But when it comes to blood sugar, some people might come in and say, I don't really feel hungry, or I feel hungry all the time, and I don't know why that's not normal for me.
Beautiful. And what I'm hearing you say is also like, don't disregard those small symptoms. I think sometimes people wait until you have like those big symptoms. Now I'm really having a problem, and now I need to go see a doctor, right? It's like it kind of starts building up slowly. And then just that constant fatigue, that's not normal. Having trouble losing weight is not normal. Not sleeping well is not normal, right? It's like when you start to notice those symptoms, don't just like, oh, it's just I'm getting old, or that's just how it is. And starting to pay attention, get closer. I talk a lot of my patients about body awareness. And the more we connect to our body, the more we're aware, the more we can start to listen to I call the whisper, like those little whispers. And then if we listen to the whispers, we don't have to wait until the body is screaming at us. We can take care right away. Then that sounds like metabolic syndrome is a big piece of that. It's just like those little things that's not really causing a big problem. A lot of times people disregard, but when you put all the pieces together and you check your lab, you're like, oh, okay, that is definitely a problem here. What can I do about it?
Absolutely. I always encourage patients, if something seems off or something doesn't seem right, even if you feel like it doesn't seem to be applicable or it seems so small, I always encourage patients to bring it up. And I know, we talk a lot about bowel habits and regularity, and it's a question I always ask my patients, are you having a regular bowel movement? And then I get pushback, well, what does that have to do with anything? And I'm like, well, if you're having a change in bowel habits, that gives us a lot of information. So even those small things can give us so much information.
Absolutely. I actually have pictures show the difference bowel movements. Patients always laugh at me. It's like, you're a physical therapist, you do holistic healing. Why I need to talk about bowels? It's like, yes, it affects everything else. It can actually cause back pain also, and all the kind of problems. That yes, that's definitely something that you wanted to keep eye on, and what's happening to your digestive system. Are things processing and detoxing as well as it should be? Then that is a really good point there. Can you tell more about that connection between the diabetes and the cardio and the circulatory?
So,
Mhm.
I always like to tell patients that when it comes to diabetes, you don't just wake up one day and you're a diabetic. It's a process. It takes place over time, and usually before you become a diabetic, we see high levels of insulin on a lab that just aren't being used, and over time that can eventually lead to other blood glucose dysregulation, which can lead to diabetes. And I always tell people, when you're diagnosed officially with diabetes, it also becomes a cardiovascular health issue. So it's almost like if you're a diabetic, we automatically assume there's cardiovascular disease present, versus if you have cardiovascular disease, it doesn't necessarily mean that you're diabetic.
That's an excellent.
So
Yes.
yeah.
And bringing just that piece of the diabetic component, even from the physical component from some of my patients, is when you start having more severe diabetes and how much affects your feet or the sensation, the circulation going to your leg, and you lose some of that perception. And that's a really good, just like a metaphor or example, probably a better word, example of how much does that affect your circulation. Then it does affect your whole body. Then it's important to keep an eye on that. And if you have diabetes, I think that's definitely like the sensation on your feet, the circulation on your feet. Keep extra attention to that because it does affect everything else. And when we just looking at things from one angle, many times we miss the others. Like, oh, it's just diabetes. Hold on, but how does that affect the rest of the body? And
Yes.
Even if it's just circulation, or if it's just digestion, like you mentioned about the bowel movement, it does affect everything else. It's all connected. And yeah, that's a really, really good point there. Excellent. Then can you share a little bit more as far as the weight loss? Why is that difficult for the people that have metabolic syndrome or anything on that area,
Yeah.
lose weight?
Well, I do want to add that, weight gain versus weight loss. Gaining weight, there could be a lot of things involved with that. It's not typically one thing, it's usually a cluster of things. But when I'm working with someone who's diabetic or has components of the metabolic syndrome, I always like to test for fasting insulin, because if insulin is high, it can be really, really difficult for men as well as women to lose weight. When that insulin's high and it's not being used, that's I would say it almost makes it impossible to lose weight at that point. There could, of course, be other things going on. We want to look, of course, at diet, or are the proper foods being eaten? Is stress level under control? There's other things to consider, but big one I do like to look at is fasting insulin and seeing where that is.
That's a really good point, to be able to not just the insulin, but the fasting insulin, the one that you do when you're fasting for the whole night, 8 hours, 12 hours of like what would be the fasting that you recommended for that kind of diagnosis?
Yeah. So, for lab work, especially if you're doing a cholesterol or looking at blood glucose or even hemoglobin A1C, it's always important to fast before those labs. And if someone's not telling you to fast before those labs, I'm going to tell you should most definitely fast, because otherwise you might not get an accurate representation of what your blood work looks like. But when we look at a fasting lab and including insulin, it gives us an idea, is that insulin too high? Because throughout the day as you eat, your insulin's going to go up and down, depending on what you eat, depending on what's needed by the body. So it's really important to have a fasting level.
Good. Thank you for reinforcing that, because sometimes I hear some patients say, well, I didn't fast as long as they ask. I was really hungry in the morning. I really want to eat something. And it's important for people to understand that there is a reason why the medical providers ask for or fasting, right? Because it does change the way your body going to process, or the results itself, the information is going to be very different if you're doing fasting versus not fasting. Then whatever the instructions the doctor gave you, please follow. It's really important. It does make a difference, and it's going to give you more reliable information, especially when we're talking about the insulin resistance or the metabolic approach, metabolic syndrome, looking at the whole system about that. All right, and now we understand what it is, what are the symptoms. Then for some of the listeners, they'll be like, wow, I think I'm starting to have questioning. Do I have this? Or I already know I have this. What can we do about it?
Well, I would say there's a lot of things that we can do. Even before seeking, I guess you could say, medical attention, whether it's through your doctor, a functional medicine doctor, or another professional. Biggest thing we can do is look at our diet. What are we eating on a regular basis? I think, and I don't want to demonize any specific type of food, but biggest thing that I tell people is get rid of the soda, the sweetened soda, get rid of the diet soda. People argue, well, it's diet. And I'm like, yeah, but it's still going to be not helpful, not supportive for losing weight or meeting certain health goals. So I always tell people, if there's one thing that you can do today, is just nix that sugary soda, sugary drinks in general, and a lot of things seem to normalize just by doing that.
Absolutely. I see that a lot of patients. The first thing I say, cut the things that are easy. You can clearly just remove the soda and all the extra processed sugar and things like that. And even if it's just starting from there, it can make a big difference. And I noticed that even with patients as far as inflammation and pain, with a lot of patients that I work with that have chronic pain, and even doing that change, it also helps to decrease the inflammation, then the pain level decreases as well. It's also a big difference on their sleeping and how tired they feel, because those things make you tired also. Then I think that's a really good tip to okay, that's a simple thing. Everybody can do it. Kind of start with that and start making those small changes. What is one step, right? Building those small habits. And then after a couple months, you have a lot of changes, but it's starting to make those small changes that everybody can do it. It's just gotta make yourself a priority and then make that anyways. Then even though sometimes it feels uncomfortable, then I think that's a really important. And is anything else that you feel would be important for people, they can do at home, they can start changing on their lifestyle to start improving the symptoms they already have, or preventing those symptoms from actually show up?
I'm a big proponent of getting out most days of the week, preferably 5 to 6 days a week, and going for a 20 to 30-minute walk. I think there's so much that can be gained just by going around the block for 20 to 30 minutes. It can be a brisk walk. It can be a leisurely walk every day. You can vary it up. There's so many great benefits. And for a lot of my patients that, that come to me and say, well, I've been diagnosed as, pre-diabetic, or I have diabetes. One trick that I've noticed is just having a walk, doing a 20 to 30-minute walk after your biggest meal of the day, just having your meal, not even doing the dishes, but going outside, going around the block for 20 to 30 minutes, getting things to start. I apologize. Getting things moving.
The pets are always welcome.
getting your body to start sensing that insulin again, and an after dinner walk for even just 20 minutes can be really beneficial.
I totally agree with that. And as a physical therapist, I agree 3 times. Yes, exercising, movement, but I like how you're saying also to do the movement right after eating to kind of really stimulate that digestion, the insulin production. And one thing I would just kind of add it to that is also understanding that you don't want to do a extraneous exercise either, just like that brief walk. You don't want it to go like just finish eating and go to a sauna and do a heat class and do something like really aerobic, because you also wanted to have the energy for digestion to happen. You don't want it to be diverting the energy from digestion for something too intense, but that small walk, some gentle exercise, gentle movement, it actually helps things to produce better and get the fluids moving. And if you, especially if you're having trouble with digestion and insulin and things like that, that's definitely a nice added that we can do it.
Yes.
Good. Anything else you want to add about that?
I think those are the biggest things that I would focus on. And I know everyone's in a different place, but two big things to look at. What am I eating on a regular basis, and am I getting in enough movement? I think those are the two biggest places to start.
Absolutely, totally agree. And can you tell us a story of someone that came into your office with some of the symptoms, was diagnosis of metabolic syndrome? Can you tell a little bit of like the before and after story for us?
So I had a gentleman come in. I believe he was in his late 60s at the time that I was working with him, and he had a pretty big job. He had a lot of responsibilities, and I remember during the pandemic they were understaffed, so he was going out, like he would go to various medical facilities and he would service different types of equipment, and it just got so stressful and he was so busy. When he came, I'm really busy at my job, but I was also diagnosed as a diabetic about a year ago. What should I do? And I wouldn't say that he was your typical metabolic syndrome case. He wasn't overtly heavy, like he wasn't obese, but he said he wanted to lose a few pounds. And definitely, like I mentioned, diabetic. I think he said he was on a statin to lower cholesterol levels. And we started, like I said before, with the basics. We looked at his diet. What are you eating? What can we clean up? What's doable for you? Since he was working a lot. What would make sense for meal prep earlier in the week that would allow you to take a healthy lunch to work? We worked through that. I asked him, end of the day, what do you like to do for exercise? And he said, well, he's like, I like to go on a walk during my breaks, but when I go home, I really enjoy being in my garden. And I'm like, okay, perfect. Let's get you in the garden. Let's get you out in nature as much as you can. Mm-hmm. And we started there. Of course, we took out any diet soda, sugary drinks, got him moving. In terms of stress, we talked through, what could you do at work that might help? Is it going to be a discussion with your supervisor about, we need to make these days manageable? Mm-hmm. Obviously we're understaffed. We need to do something. I can't be at 5 different places at the same time. Mm-hmm. So opening up that avenue for a discussion and, figuring out how to make that stress more manageable to get through your day. And I would say within about 2 weeks, he messaged me. He's like, wow, he's like feeling a lot better. My energy's up. And, before he never even brought up energy, but all of a sudden it's like, wow, my energy's up. I'm feeling better. My belt's fitting looser. I don't have to, I'm starting to, lose an inch or two around my waist. He was really excited about that, and really started to build up that momentum for other healthier changes that we eventually added on as we work together. So
Oh, I love that. That is so beautiful. And I think a couple things that you say that they really uh, hit home, and I see that on my practice as well. First, it doesn't have to take long. Like, yes, some situations take, of course, a lot longer. They're much more complex. And there are also a lot of people that can see the difference with 1, 2, 3 months of changes. Then that's very encouraging for people that's been suffering with some of the symptoms for a long time. And I think the key for what you're saying there is make sure that you hit the right problem. Like you with him, identify exactly what's the cause for his problem. And then when you address that, then it made a bigger difference faster for him because you were like right on what the problem was. Then I think that's just kind of validate the point also to find really good health providers, like people like you that really know what you're talking about, and you're going to look in the holistic approach, especially for metabolic syndrome. It can't just be 1 and 2 and 3. It needs to look at the whole angle to make a bigger difference. I think that's really important there. Another thing that you mentioned there that I think is important for everyone to hear is diabetes doesn't always have to be obese. I see a lot of people with that misconception of like, oh, but I am not overweight, therefore I don't have to worry about how much sugar I eat. And that's not true. Like they can be with a regular size and they still have high cholesterol or sugar and like insulin resistance and all of that. It doesn't have to be always obesity. Would you agree with that with your experience?
I would agree. I would say, when it comes to working with people who are diabetic, I mean, the typical picture or the, I guess you could say the picture we have in our mind is somebody who's grossly overweight. And with that comes, difficulty sensing insulin and using it appropriately. But there's also a small group of the population that, they look average, they feel fine, but for whatever reason the blood glucose level is just dysregulated. So it's really important to look into that and figure out what else could be going on in that case.
Exactly. What goes back to the root cause, right? It's like go, what is your problem? What's causing your problem? I think that's such an important piece for people to realize. It's like, okay, there is no one solution for everyone. We gotta go deeper there and figure it out. Okay, what's your problem? And that's again holistic practitioners, naturopaths, doctors, like really come in as such a crucial piece of the puzzle to be like, okay, but why? I'm having this problem, but why? Right? It's like the body is made to function properly. When the body is not functioning properly, we gotta go back to why not? Then I love what you're saying there. Beautiful. And then the third piece that, from your story that really takes me, and I see that in my office all the time, stress.
Yes.
I think we can do a whole nother podcast on that topic. This is such an important topic. I see a lot of people, they're like, oh, I'm not stressed at all. I'm just living my life. And first, they don't even realize how stressed they are because they are on that constant go, 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 go. And you look at the person can barely take a deep breath, and like the heart is racing all day. It's like, of course, it's going to affect your heart. Of course, it's going to affect your nervous system, your circulatory system, and everything else in the body. Then when we have that constant stress, it's so important to address that as well. Then having all the extra pieces and the treatments and the changes on the diet, like even if we change the diet, do the exercise every day, but we still on that state of stress all day long, it's harder for the body to heal. Then we gotta drop to that parasympathetic, relax, digest, rest, healing, that the body can go back to like, oh, okay, I can start to repair things here. I can take all the good food that we are eating and start to using that the best way, get the digestive system to work better, be able to sleep deeply. Then that's a big piece as well that will absolutely impact the metabolic system. And it's not to say that it's on your mind. I always like to make that clear. We'll not say that you're imagining things, that you're creating things. Don't go drink a glass of water or a glass of wine and think problem is going to solve. That's not what I'm saying. is really that stress in the body. It's the sympathetic response, like fight, flight, freeze. It's a real thing, and it needs to be addressed.
It is. It is. I have an interesting story around stress. I have a colleague who he decided to wear a CGM to monitor his blood glucose, and he wasn't diabetic at the time, but he was interested, and so he signed up for a subscription and started wearing a CGM for about a month. And he was telling me a story where he was sitting at his desk and he got an email from, I think it was a patient or a family member of a patient. And it was a very stressful email. I don't remember the news, but he said something about the email was really, really stressful. And he caught himself for a minute and he's like, I'm really stressed. I'm really on edge right now. And the timer or the alarm on his CGM started going off, and he looked at his phone, and I think he said his blood glucose had risen by like over 50 or 60 points just from that small burst of I got an email and I'm alarmed by it. Really just set off his blood glucose. And where that's coming from is when we're stressed, fight or flight, that increases cortisol in the body, and cortisol basically causes the glucose to mobilize, and then that can basically increase blood sugar. So really important to look at stress, especially with regards to insulin resistance as well as diabetes.
Absolutely. I totally agree. And stress affects everything, including inflammation, your digestion, your nervous system, your sleeping, of course, the insulin as well. That's something that it's a big part of my work with the patients, even when they come to something totally unrelated, because whatever we do to manage the stress will help everything else to heal. And it does make a big difference. And I love how your friend was able to identify the stress and like, wow, I am in that stress reaction before they even see the app, right? I think the apps and the information, especially now with AI, is getting like, oh, it's a lot of information, a lot of data that we can collect and notice. And I think it's also important that we have that internal awareness in combination with the external device. And I love that you brought that. It's like he noticed first, and then he went to the device. It's like, oh, it just validated what I was feeling. It's not just be relying on the device to tell you how you feel, right? It's like we need to know our body. We don't need a device to tell us. It's added information. It helps, but we should know our body better than anyone else. Then that was a really cool story.
Yeah.
Very nice. Then what are the 3 tips that you wish all your patients knew to improve their health?
The 3 tips, I would say the big 3 that I really like to stress, especially to patients. 1, the importance of eating real food. And, real, when I say real food, I mean, stuff that comes from the ground, from the tree, pasture raised, not stuff that's coming out of a box off of a grocery store shelf. Really just getting food in the most unadulterated state as possible.
Mm-hmm.
That's where you're going to get the most nutrients. That's where you're going to get the most nourishment, is from those whole foods. The second one that I would say is when I speak to people, I always ask them about boundaries. And these are boundaries at work, setting boundaries with coworkers, setting boundaries with loved ones, whatever relationships they happen to be in, really to make sure that we're protecting ourselves, protecting our energy, not putting ourselves in a position to be burnt out. Because if we're burnt out, we're coming from a place where we're tired, we're fatigued, we're probably stressed. And we just had that whole conversation about stress. So making sure that appropriate boundaries are set. Good. And then the third one I would say, and I always ask patients, what is your life purpose? Why are you here, and what makes you get out of bed in the morning? And I find that patients that have a life purpose or have identified what gets them out of bed in the morning, typically do better than people that say, well, I don't know what my life purpose is, or worse, I'm not interested in knowing what my life purpose is. And I always encourage that self-reflection. What do you want to do? If you're not happy with where you are, where do you see yourself? Where would you like to be? And then taking the steps to put yourself closer to where you want to be.
Oh my gosh, I love that. Love, 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 love. I totally agree with all of that. Life purpose makes a huge difference. Just waking up, we have that feeling of like, I want to be here. That's why I'm waking up in the morning. It makes a huge difference in everything else. And boundaries is so, so, so important, especially coming up of the holiday. We're actually doing a whole month of November. We've been talking about boundaries and learning how to create those boundaries with yourself, with your family. And we actually had a very, very interesting experience yesterday. I was teaching a class, a movement class, and talking about boundaries with your body. And I had one of the members of our academy that she came with like foot pain, and she was really uncomfortable. She's like, I have a headache. Everything just kind of doesn't feel right. And we were doing a specific movement that was helping to create boundaries. That was as simple as that, but as complex as that. And yes, after the movement, she's like, oh my gosh, Anna, my pain's gone. And she's like, I did all these physical things and it wasn't improving, it was actually making worse. But when I put the intention of creating boundaries and really having that limit not being pushed, my body was able to relax and the pain was disappear. And she was kind of surprised, even though she's having many experiences like that working with me before. But it just kind of reminds us how much the stress, emotional, the body keeps the score. And every time that we say yes to someone and we say no to ourselves, we are keeping the score in the body. It's really important to be able to address that and not letting the body stay sick or feel uncomfortable to please someone else, right? That is the limit there. That's really important to bring that to awareness. I love it. I love it. I love it. Is anything else that you'd like to share before we close for today?
I think we had a great discussion, and I think what we talked about is, a good amount of information for those listening to consider, digest, and certainly if there's any questions, if anyone wants to reach out to me, we'll share my information and go from there.
Absolutely. Absolutely. I think we share a lot of information. Hopefully everybody was taking notes as much as I was. And just to recap, I would love to hear from you. What are the changes that you're going to do? Then pick one. You don't have to do all the changes, but just some of those suggestions. Pick one, write it on the comments, share with us. What is one thing that you can start changing today? That we talk about eliminating soda, decreasing processed sugar in general. We talk about stress management being very important, walking every day, especially right after eating. Like all of those things are very simple. Everybody can do that. And they start noticing, how does that feel? Make sure that you get your checkup every single year. Check all your lab work, make sure everything looks good, consult with your doctor. If you need help, please reach out to doctors like Dr. Kellyanne to help you with moving you forward and make sure that you feel better. Then can you share with us what would be the best way for the listeners to contact you?
Yes. So best way is it can be done through my website, which is rockandStemHolistics.com. And listed on there, you can also reach out to me via email if you like. There's a section on the website. If you want to send me a comment, you can do that. Otherwise, you could also email me at info@rockandStemHolistics.com.
Fantastic. And we will have all those links listed in our show notes. To make sure that you check our show notes at www.behealthwithana.com/podcast. So you can check all the links that we are referring today. And is that a gift that you like to offer to our listeners today?
Yes. So for those that have listened to today's podcast, if you decide to reach out to me, whether through email or through my website, just mention to me that you heard my conversation with Anna on this podcast, and I'd like to offer you a 15% discount. We can use it on a I was thinking for the initial intake, if you'd like to do a naturopathic consultation, I'm happy to give you a 15% discount. I would say up and through the holidays, so up until the Christmas season.
Okay. Oh, that sounds like a great gift to yourself. I may pick you up on that and get myself check out with you. That sounds wonderful. Then you guys make sure that you take advantage of that. That can be the best gift that you can give it to yourself or family member. That's a really nice way to help other people there experience problems as well, especially for yourself. Then yes, make sure that you contact Kellyanne and schedule your appointments. And thank you so much, Dr. Kellyanne, for joining us today and sharing all your wisdom and all your tips. I think the listeners got a lot of this information and they will start taking actions and seeing the results for sure.
Yes, thank you so much for having me.
Yeah, and thank you so much for listening to today's episode. If you enjoy it, make sure you subscribe to our channel, leave us a review, and share our podcast with anyone that you know that needs to improve their health. If you are watching this on YouTube, hit the notification bell so you get notified whenever we upload our next episode. And if you wanted to work with me and learn how to ignite your self-healing abilities so you can save money, time, and decreasing pain, join Be Healthy Academy. If you're ready to reclaim your life and heal from chronic pain, make sure that you join us today. Be Health Academy is a science-based program that offers accountability, pain science education, stress management techniques, ways to shift your mindset, increase body awareness, and techniques to release the trauma from the body, and so much more. With the right resources, you have the ability to heal yourself. And you don't have to do it alone. Let me show you the way. Join the Health Academy. And that's it for today. Keep it up the good work. I will talk to you later. And until then, be healthy.